You finished treatment. You did everything they told you to do. You rang the bell. You showed up to every appointment, every infusion, every follow-up scan, and you survived. And now, somehow, you feel worse than you did before. Your energy hasn't come back the way you expected. The weight that arrived during treatment is still there. And even though you're eating the same way you always did, you're sleeping 8 hours and waking up exhausted. And your body feels like it belongs to someone else, someone about 20 years older than you. And everyone keeps telling you this is normal, that it takes time, that you should just be grateful. I'm going to tell you something different today, because that experience you're having, it has a name, it has a mechanism, and most importantly, it has a solution. But only recently have people really begun talking about it. I've been there. I'm Dr. Hellena. I am a double board certified physician. I'm certified in physical medicine and rehabilitation and lifestyle medicine with culinary medicine training as well. I specialize in metabolic health and cancer survivorship medicine. And I am also a triple negative breast cancer survivor. I have sat in the chair you are sitting in. I have felt what you were feeling. And I'm here today, not just as a physician, but as someone who lived this from the inside. And I recognize, oh my goodness, that not all of our brothers and sisters who've had cancer actually get to see this side of it. I am now 17 years out. And what I'm about to share with you is the conversation I wish someone had had with me after I finished treatment. Stay with me. This is important. And again, I recognize that it is a blessing to be me. It is a blessing to be a survivor. But the good news is there are more and more of us. And we recognize at this that survivor, and there are things you can do. Actually feel your very best. So let's talk a little bit. Let me ask you something. How old does your body feel right now? Not the age on your driver's license, not your chronological age. I mean, the age that your cells are actually living. See, there's something researchers call your biological age. It's a measure of how fast your body is aging at the cellular level. And it's completely separate from how many years you've been alive. You can be 45 years old chronologically, but have a biological age of 62. And that gap is not random. It's caused by specific measurable things happening inside your body. And cancer treatment, that's chemotherapy, radiation, and hormonal therapies, it's one of the most powerful accelerators of biological aging that we know of. And here's what I mean by that. There's a process called inflammaging. That's a word that researchers coined by combining inflammation and aging, because what they discovered is chronic low-grade inflammation is one of the primary drivers of how quickly the body ages at the cellular level. Inflammaging is the slow burn, that quiet background fire. It shows up as fatigue that does not lift. It's weight that moves in and refuses to leave. It's joints that ache. It's the cognitive fog, that brain fog that you have, and a body that simply does not respond the way it used to. Cancer treatment, especially chemotherapy, does not just kill cancer cells. It creates an inflammatory environment at the cellular level that in many cases doesn't fully resolve after treatment ends. That's right, it doesn't fully resolve after treatment ends. Combine that with the mitochondrial damage from certain chemotherapy agents, and what you have is a body whose cells' power plants are now running at a fraction of their capacity. I say it to my patients this way. Imagine your cells used to run on a high-performance engine. Cancer treatment put that engine through something extreme. The cancer is gone, but that engine is still running rough. And nobody handed you the repair manual when you walked out the door. That is what is happening. And it's not your fault. And it doesn't have to be permanent. So I want to give you the specific mechanisms that cause it because I think you deserve to understand your own body. That's half the battle right there, right? This is your biology. You have a right to know what's in it and what's driving it. In my practice, I work within a framework I call mitocellular restoration. The idea is that real metabolic healing, the real weight loss, real energy restoration, real functional recovery has to happen at the cellular level first. You cannot outrun a broken cellular environment with discipline and willpower. Let me walk you through what I mean. Mechanism number one, mitochondrial dysfunction. Your mitochondria are the organelle inside your cell that produce energy. Specific chemotherapy agents, particularly the anthracyclines like doxorubicin, also known as the red devil, are directly toxic to mitochondria. And this is known and documented. What is left often discussed is what that means for your daily life after treatment. You'll recognize it once I go over it. It means your cells are producing energy inefficiently, which means your body fatigues faster. It means your metabolism has slowed, not because you are lazy or doing something wrong, but because your cellular machinery took a hit. Mechanism number two, chronic inflammation. So I described the inflammaging a moment ago, but I want to go deeper here. After chemotherapy and radiation, markers of inflammation like C-reactive protein, ferritin, and interleukin-6 are often chronically elevated. High inflammation tells your body to store fat, not burn it, and it disrupts insulin signaling. It interferes with hormone function. It is the reason that eat less, move more simply does not work for many cancer survivors. The inflammatory environment is working against the effort. Mechanism number three, hormonal disruption. Want to talk about that? This one hits cancer survivors especially hard. Chemotherapy-induced menopause, or as I prefer to call it, chemopause, is not the same as natural menopause. It can be threatening. It can be severe. And it creates a hormonal environment that dramatically alters the body's metabolic foundation. Estrogen plays a role in how your body distributes fat, how sensitive your cells are to insulin, and how your mitochondria function. So when it drops suddenly and severely, either from chemo or surgical menopause, the metabolic consequences are profound, and they occur much suddenly again than the natural menopause. So for patients on aromatase inhibitors, medications used to prevent estrogen-sensitive cancer recurrence, this hormonal disruption continues for 5 to 10 years after treatments end. And of course, chemopause can be permanent. I have patients who are doing everything right and still struggling with weight and fatigue because their endocrine environment is working against them in ways that no one has ever explained to them. Mechanism number four, muscle loss, the hidden tax. Here's one that almost nobody talks about in relation to cancer treatment. Cancer treatment accelerates muscle loss. Now, lately, and especially if you've been following me on my social, you know that GLP-1s have been big in the news for causing muscle loss and sudden weight gain after the cessation of GLP-1. Chemotherapy, inactivity during treatment, the inflammatory state, and the hormonal changes, all of these combine to reduce lean mass significantly. And muscle, again, is not just about how you look. It's not just aesthetics. It's a metabolically active tissue. The more muscle you have, the higher the resting metabolic rate, the better your insulin sensitivity, and the stronger your immune function. So when cancer survivors lose muscle mass during treatment, their metabolism shifts in a way that makes subsequent weight management extremely difficult. And the standard approach of calorie restriction actually makes this worse. Restricting calories without addressing the muscle loss equation further slows the metabolic rate. and deepens the problem. So I want to stop here and be personal with you for a moment, because I'm not sharing this information from the outside looking in. Yes, I'm a PM&R doctor and the lifestyle medicine doctor who ran a PM&R cancer rehab clinic with a team of therapists for years. However, it's much more personal than that for me. For some year, actually, I guess it was 1 to 2 years after I completed cancer treatment for the triple negative breast cancer, I was living every single one of these mechanisms. I was eating whole foods. At times, I was vegetarian and vegan, actually vegan. Um, and I remained primarily plant-based, and I was working with the personal trainer 3 times a week. She was great. I loved her. She made it seem like play instead of actually working out, which was the key for me. It has to be something I enjoyed. And I did it regularly, enthusiastically. And I did a 3-month juice fast. Not juice plus meal, but just juice, primarily green juice, for 3 months. And I initially lost weight up to a pound a day. But then it plateaued. And then I started to gain weight. I want to tell you what that felt like as a physician, because there's a particular kind of shame that comes with being a medical professional who can't solve her own body issues, right? I felt the judgment from colleagues, from patients, from myself, even my wonderful trainer when I said, you know, the only thing I can seem to do is this juice fast, and I can't do that forever. And she actually asked me why not. And I love her to death to this day. But I knew I needed more, and I knew it was deeper than just the, again, calories in, calories out. But the assumption from everybody was that I was not practicing what I preached, that I wasn't disciplined enough, and that I should know better. But here is what was actually happening. Nobody had looked at what was happening at the cellular level. Nobody had measured my HSCRP, my fasting insulin, my HOMA, IR, my mitochondrial function, my lean mass versus my fat mass. Nobody had connected my treatment history, my specific chemotherapy agents, my hormonal disruption to what I was experiencing years later. When I finally got the right labs and the right imaging, the picture became completely clear. My cellular environment was in disarray. And don't get me wrong, my oncologist had done DEXAs, but she was more concerned about my bone density. We didn't even discuss my lean mass versus my fat mass. And it was just one of those things. My body was doing exactly what a body does under those conditions. And no, again, it was not a willpower problem. It was a biology, physiology. And I could fix a biology. That's when I decided to go further into this. I had a great mentor who did weight management and metabolic health. And she also focused on the biopsychosocial, which is huge, right? When it comes to dealing with the full array of how our bodies respond to what we present to them. Because I knew that if I, as a physician, had not been able to navigate this on my own, my patients had had no chance of finding their way through it without someone who understood both sides of the equation. So let me tell you what I have seen work, not just in my patient, but in my own body. The first thing I want to challenge is the idea that weight is the primary goal. Now, I understand why it feels this way, and I understand that you, like me, have been watching the scale for years. But the scale doesn't tell you anything useful about your metabolic health. It's just a reflection of what's going on. It doesn't tell you your visceral fat level. It doesn't tell you your lean to fat mass ratio. It doesn't tell you about your inflammatory load or your insulin resistance. So we often get focused as patients, we often get focused on the wrong numbers, right? In my practice, we use clinical grade body composition technology, specifically the human body pod or human body scale, which gives us the same accuracy you would get from a DEXA scan. And when a patient sees that their actual body composition for the first time, sees their visceral fat measurement, their lean, their resting metabolic rate, something shifts. They stop fighting their body and start to understand it, especially as we track it as you go through the restoration, uh, as we like to call it here at Restored. As you go through that restoration, you'll see changes and you'll see not only that understanding it is the beginning of real progress, but it helps you actually understand where and when you need to tweak and adjust because our bodies are unique and each one does differently. And what works today may not work tomorrow because we are still in evolution. The second thing I want to address is GLP-1 medications. Now, these have become enormously well known in the last few years. And just as big is the confusion about what they are and what they are for. So for cancer survivors, I want to reframe GLP-1 therapy entirely. These medications are not just weight loss tools. They have documented anti-inflammatory properties. They have metabolic benefits that go far beyond the pill. And used as part of a comprehensive metabolic restoration protocol, not in isolation, they can be genuinely transformative for cancer survivors who have been fighting an uphill biological battle. But, and this is critical, GLP-1 meds carry a real risk of muscle loss if they aren't paired with the structured resistance training program and the protein protocol. Some studies show that 25 to 40% of weight lost on GLP-1s alone can be lean mass. That means a survivor who has already lost muscle mass through treatment could lose even more if this is not actively managed. Now, I have a documented muscle protective protocol that every GLP-1, I call it my MPP, every GLP-1 patient in my practice receives it at intake. Okay? And it's different for each of us because, again, we each are particular and specific, but there are some similarities and some commonalities. And this is one of the primary things that differentiates a physician-led survivorship program from a telehealth GLP-1 prescription service. Okay? I'm just saying. And third, and I can't say this enough, this work happens at cellular level. You cannot address post-treatment metabolic dysfunction by treating symptoms. The treatment plan has to address the cellular environment, the inflammation, the mitochondrial function, the hormonal landscape, the gut microbiome disruption that chemotherapy causes. That is what mitocellular restoration means. We are not managing numbers on a scale. We are rebuilding what happens at the cellular level. So if you're watching this video, I want to speak to you directly. You might be a cancer survivor who finished treatment and never got back to where you were before. You might be someone who's dealing with weight that arrived during chemotherapy and refused to leave. Okay. You might be someone dealing with weight that arrived during chemotherapy and has refused to leave. You might be someone dealing with weight that arrived during or after chemotherapy and has refused to leave, despite everything you've tried. You might be experiencing the fatigue, the brain fog, the joint pain, the hormonal chaos that nobody warned you about. You might have been told more than once that what you're going through is just part of recovery and to give it time. I want to tell you, if that's the case, you're not broken. You are not failing. Your body is responding logically to what it has been through. And there is a clinical pathway forward. What I offer isn't a diet program. It's not a weight loss challenge. It is a physician-led metabolic restoration program built specifically around cancer survivorship and the biological changes that creates. Mind you, chronic obesity, adipose tissue in itself also creates low-grade chronic inflammation. And so if you have been dealing with weight issues for a lifetime, have been chronically obese, then you too would benefit from this program. We use body composition analysis, comprehensive lab panel, GLP-1 therapy when appropriate, natural alternatives when appropriate, muscle protective protocols, and lifestyle medicine, all within a framework that addresses your cellular environment, not just your weight. It's your overall health and quality of life that I'm concerned with. If you want to know where your biological age actually stands, if you want to understand what is actually happening inside your body and what the pathway forward looks like, I want to invite you to comment the word survivorship below, or click the link in my bio to take the weight loss roadblock quiz. It takes 2 minutes. It will show you exactly where your metabolism is stuck, and it is the first step toward getting real answers. And of course, if you just like to do a consult with me, please feel free. We'll put the link below for you to click and make an appointment for a consultation. And look forward to what's to come. If you've got any topics that you would like covered, please feel free to put them below. Next week will be a general weight management week. And the following week, we will be covering Chemopause. But again, I look forward to dealing with topics related to survivorship from a medical patient point of view. In health and wellness, be well, be whole.